You're looking at a lifesaver in training. Lene Wagner is learning to use medical tools in this Red River College lab to help future patients, but she's also learning tools to help herself.
I was a little stressed out during my first term. There's a lot of adjustments because I've never been tested in a hands-on way.
As a first-year nursing student, Wagner thrives under stress, but she finds it can be distracting. That's why she's part of a college pilot program to implement mental health education into the nursing program. This is part of a proficiency test that first-year students do in their first term. It's checking your vital signs and your blood pressure. Some students get pretty anxious and they get a little worked up so they can't focus, but the students in the Mindfulness for Workshop program say they're using tools to ground themselves and focus.
Basically, that's what you're trying to do, anchor yourself to the present moment, right?
This is a grounding exercise to help focus, reevaluate, and succeed.
In our individual sessions, we see students experiencing anxiety and depression and other sort of issues, things that are so preventable, things that are so manageable, but they impact the ability of the student to function. So if we can give them the tools to manage that, to experience life better, why wouldn't we do that?
The group talks about their week and practices mindfulness tools and tests. Bonneau says the goal is to bring the workshops to all RRC students. That might help keep Wagner in class and eventually in the hospital.
You want to stay so much with your friends, with your peers, and you don't want to fall back a year. So, because it's a condensed 3-year program, you don't want to miss a step.
The students will meet once more, then they'll evaluate the program. Samantha Sampson, RRC TV.